Well, I think we have to take it seriously, and I welcome the government's swift action. We think the government should go further. We think there should be testing as people come into the UK, not just on day 2. And I'm very passionate about making sure the government do more to ensure that people get sick pay so that people can do the right thing and isolate when they need to. We've asked for ventilation in places like schools, and the government need to really be clear on the mask wearing indoors at venues. And we know the Prime Minister has undermined his own message in the past, but we need clarity now so that people can do the right thing.
But you can automatically test as soon as you come into the country. It's day 0 to day 2, isn't it?
Well, at the moment, what the government are saying is that when you come into the country, you do a day 2 test. What we're saying,
to a day 2 test,
yeah,
not day
and
2.
what we're saying is that people should actually have a test before they come into the country.
OK.
And that would be
so wherever they are, they should be tested
Wherever
first.
they are, that people should be getting tested before they come into the United Kingdom, yes.
And what about planes that are coming in from South Africa at the moment? Because we saw what happened in Amsterdam. People were taken off the plane and taken to a place where they were tested. That didn't happen in the UK.
Yeah, well, we think, again, the government have acted swiftly, and that's right to do so. People should be isolating if they've come from South Africa, and therefore they should be getting those tests and making sure that we keep track of where this virus is. It's important that we're able to do that and that people are able to do the right thing, and that's why I think it's important that sick pay is dealt with now. We've had this problem throughout the pandemic, and the government really do need to take swift action so that people can do the right thing. We've been living with this virus for a very long time now, and many people fall through the loopholes when it comes to getting sick pay so that they can do the right thing.
So where are you on working from home?
Well, again, we think the government should encourage people to work from home where possible. Again, if we've got infection that's rising in the UK, and we know that this variant is meant to be more infectious, that it's easier to catch, that actually working from home is a good thing. And, I've talked about the future of work as a Labour policy going forward, that I hope that employers can be more flexible with the way employees work, because we've seen that through the pandemic, they can do. And it's actually good for work-life balance as well. So we encourage people to be able to work from home where that's a possibility.
You say much more infectious. The South African President, Ramaphosa, said he's deeply disappointed by decisions to impose travel bans on South Africa and that they have no scientific basis. Why is he wrong?
Well, I'm not saying that he's wrong. What we're saying is the government have acted swiftly, and that's right that they have done so. And the World Health Organisation is looking at this issue as well, and that we need to make sure that we're doing everything we possibly can to get a grip of this virus so that it doesn't spread. We're going into the winter months now, and we know that that's a real challenging time for our NHS anyway. So if we have high infection rates and people needing hospital treatment, then that will put increased pressure on our NHS services. So we've got to do the right thing to try and limit the flow of the infection rates in the UK, and that's why it's right that the government take action immediately.
The government is also saying that anybody that comes into contact with somebody who's got the Omicron variant, they will have to self-isolate for 10 days. Should that be the case with children as well?
Yes, but I'm not quite sure how the government are going to identify when people have got that variant. I think that's still quite unclear. But the PCR test, not every single PCR test is tested on the genomes and what the virus is. So I'm not quite sure they've got that fully set up yet. I would be happily corrected by the government if they come out and explain to us how that's going to happen. But it is important that we get control of where the virus is and that people can self-isolate and follow the medical and science advice to make sure we control the virus.
But children should have to self-isolate as well if they come into contact with somebody who's had the virus?
Children can spread the virus as well, so therefore if they are in contact with someone who's got the virus, then yes, anyone who's been in contact with the virus should self-isolate.
Chaos in schools, isn't it?
Well, we've seen chaos in schools, but we've known that for 18 months now that school children have had to leave the classroom. We've had classrooms that have been shut for COVID outbreaks in the past. The government needs to do much more to ensure that children can have hybrid home working. Some children still don't have access to Wi-Fi and to laptops and to online courses, so we've got to make sure that every child can access their learning and that catch-up's in place. Again, the government's own person that they recruited to do the independent inquiry into what was needed for catch-up left the job because the government refused to do what he recommended was the case. So again, the government really do need to come forward to help those children to get their education, but we've got to make sure we control where the virus is as well. So if the science advice is that they need to self-isolate, then of course we should be doing that.
Given that we're so close to Christmas, is there not an argument for closing schools early?
I don't think there's an argument for that now. I think the most important thing is that the children
that
have
would stop
access
the spread then,
well,
wouldn't it?
you know, my children have to take tests. They get them regular. They get them free from the school. So we have a pile of them and they take tests very
but those
regular.
lateral flow tests won't pick up whether it's PCR, whether it's a variant or not, will they?
Well, they won't, but you'll know whether you've got COVID, and if you've got COVID, you should be self-isolating. So, again, we've got a regular testing system. We've asked that ventilation are in schools as well, and that hasn't come forward. And we're in, you know, we're in 18, 19 months, 20 months since we knew about this virus. So there's really a need for the government to make longer-term plans about how we ensure that children, if they have the virus, they can still get their education.
How should we decide who's on the red list? If there are European countries, particularly the Netherlands, that have got a high number of cases, more numbers than they have in South Africa, should they be on the red list as well?
Well, again, we should be following the scientific advice there. If the scientific advice is that we should be putting them on the red list, we should, you know, we shouldn't be taking any chances. We should be, again, if we're testing people as they come into the country, again, we'll know whether the virus is entering the United Kingdom or not. And that's why we think it's important that the government do that. I mean, the virus will circulate globally. And again, you know, we've seen Gordon Brown has raised in the last 24 hours the fact that we haven't even met our G7 targets to vaccinate the whole of the world. And there's no point in vaccinating the UK if the rest of the world has the virus and it brings back into the UK. So we've got to do more to protect our borders, but protect the whole of the world against this virus by, you know, we had a great opportunity with the Oxford AstraZeneca vaccine that we were able to develop through our scientists in the UK. We should be exporting that across the world, making sure that everybody gets access to that vaccine.
I understand, but my question is, in order to protect our borders, do we need to add more countries to that red list? If they have, you know, how do we decide who's on the red list and who isn't?
If the science advice is that they need to go on the red list, then we should be doing that. We should be doing everything we possibly can to control the virus. But the red list is not the be-all and end-all. Like I say, testing is part of that. It's very important we do that. And vaccinating across the whole of the globe is very important in that. It's not just one thing that will fix it. There's a number of things that we need to do.
So what about people that have organised Christmas holidays, skiing or whatever? And there are cases in Europe at the moment, as we saw. Should they be thinking again about travelling?
Well, again, we've got cases in the United Kingdom, so it's not just about where you are in the world. It's about...
So do we stop travelling?
No, what we do is we have testing in place so that we know where the virus is, that we, you know, when you have the opportunity... We do if we're testing, and that's why it's so important. And again, like I say, coming into the United Kingdom, we should be testing people before they enter into the United Kingdom as well, so that we can see where the virus is coming through our borders. But we have the virus here in the UK as well, and that's why it's important that we fix our sickness so that people can be off sick when they need to be and they self-isolate, and that our testing regime follows up. Again, it's a bit patchy at the moment on day 2, whether people get that follow-up and whether we're keeping control of where people are and whether they're getting that test and whether or not they've got the virus and are doing the right thing by self-isolating.
As far as mask wearing is concerned, you don't need to wear a mask in the pub or in a restaurant.
Well, we think that in hospitality settings that people should be wearing a mask. I got the train here yesterday evening and it was absolutely rammed. You couldn't even stand up. It was so full. And very few people were wearing a mask on that train. And again, it's so important that people wear masks when they're indoors, in arenas where they're meeting people and, you know, it's mixing in large numbers. People should be wearing a mask.
And what about, I did put it to the Minister, that you don't actually need to wear it in the pub?
I think people should, you know, especially if you're moving around the pub, people should be wearing a mask in hospitality settings. And, you know, if you're in an indoor setting, there's no distinction between a pub, sitting in a pub or sitting in on a train or sitting in a hospital. You know, it's still a venue that's indoors and we should be taking the necessary measures to protect people around us.
And is it right, and will we continue to have a knee-jerk reaction to every variant until we know what it's going to do?
I think it's right that we respond to every variant that comes through. We know that that's going to be an issue for us. We do need to, however, make sure that the G7 commitments that we made are honoured and that we are able to get that vaccine across the whole of the globe, because we see that the more the infections increase, the more variants happen and the more mutations happen with the virus. So we've got to tackle this globally and not just see it as a UK issue.
Always great to see you. Thanks very much.
Thank you.
Great shoes.